we are putting the icing on the cake. So many of you who've been here before or watch my Instagrams know that I talk about baking a cake resembling a body lift. You have to bake the cake first and then sometimes come back and put the icing on it, meaning that you have to do the body lift first. And sometimes patients desire to put an icing on their cake, an icing on the body lift. So we've done a body lift. What do you think? Amazing. Amazing. And now we're going to take it one step further. So today what we're going to do is actually we're going to do liposculpting and lipo-etching. So there are some areas that she has a little bit more prominence. We're going after perfection in a sense. She looks great. We're going to take it one step further. She's a 10 out of a 10. We're going to make her a 12. Right?
Wrong way.
So here, her rib cage is sticking out more than here. We're going to remove some fat from this side to make it symmetrical with this one. She has had a prior breast lift somewhere else, and actually it's really good results. But we're going to kind of optimize it by removing the fat around the breast and put the fat in the upper aspect of the breast. We're going to lipo-etch her so she's got a feminine and beautiful but subtle and natural looking abs. I hate making six packs on women. I think it looks super unnatural. And God knows if these are going to stay or not, because if you gain weight and lose weight, your six pack may become 12 pack, in a sense. So we're going to continue our feminine approach and not try to make her masculine. So we're going to lipo-etch her. We're going to take more fat from her hips. So bring everything in, create a beautiful high definition look in the, we're going to liposuction the inner thighs. This can create skin laxity and she's already aware, but we're still going to take the bullet and see if we can get away with it. We're going to do some scar revisions to just make the scars look perfect. Some areas have become wider, so we're going to redo those areas and lift a little bit more, go after the final minor skin laxity that has developed after this was done, what?
10 months ago.
10 months ago. So we're going to remove a little bit more skin, again, removing a little bit more fat. So once you do a body lift after 10 months, after 12 months, your body settles. It develops fat pockets in areas that you may have not had them. You gain 2 pounds of weight and instead of it going here, it may go here now. So things shift and we're going to correct those shifts so that we can land and end up with a more permanent and beautiful result. We're going to put a small amount of fat here. So as you see, lots of small things that just, it's like putting the icing on the cake. The cake is baked and we're going to go and just make it look beautiful, even more beautiful. So here we're going to do some liposuction. She has skin laxity and I've told her that this may make her skin laxity worse, so I have to be very cognizant of that. But we're gonna shape this, take the saddlebag fat out. I don't think it's too much. She thinks it's too much, so this is by order. And then we're gonna put some fat here and end up our surgery. So, how excited are you?
Very.
Okay, let's get going.